What if you were living with a disease right now and didn't even know it? A disease that doesn't make you cough, doesn't cause a rash, and doesn't always hurt. But silently, day by day, it's damaging one of the most important organs in your body, your liver. This is a reality for over 350 million people around the world. And the name of this silent threat? Hepatitis. In this video, you're going to learn what hepatitis really is, how it works, and why ignoring it could be fatal. Let's break it down. Hepatitis means inflammation of the liver. Think of your liver as your body's natural filter. It cleans your blood, digests nutrients, stores energy, and fights infections. But when it becomes inflamed due to a virus, toxins, or your immune system turning against it, it stops functioning properly. Imagine the garbage collector in your town suddenly going on strike. In a few days, waste starts piling up. In your body, that waste can turn into toxins that affect everything from your energy to your brain. Types of hepatitis. Hepatitis isn't just one thing. It comes in different types. Each one spreads differently and affects people in unique ways. Let's go through them quickly. Hepatitis A. It is usually caused by eating or drinking something contaminated. It's common in areas with poor sanitation. Good news? It's preventable with a vaccine and usually doesn't become chronic. Hepatitis B. This one spreads through blood, unprotected intimacy, and even childbirth. It's a serious threat because it can become chronic and lead to liver failure or cancer. But again, we have a vaccine for this. Hepatitis C, the silent stalker. It's often spread through blood, such as unsterile medical procedures or needle sharing. Most people don't even know they have it until years later. But the good news? It's curable with antiviral drugs. Hepatitis D and E, less common but still dangerous. Hepatitis D only infects people who already have hepatitis B. Hepatitis E is mostly waterborne and found in developing regions. Non-viral hepatitis. Sometimes it's not a virus at all. Alcohol, certain medications, or even your immune system can cause liver inflammation. These types are just as dangerous, especially if ignored. How hepatitis spreads now. How exactly does hepatitis get into the body? The answer depends on the type, but here are the major ways it spreads. 1. Contaminated food and water. Hepatitis A and E are usually contracted by eating food or drinking water that's been contaminated by human waste. This often happens in places with poor sanitation or unhygienic cooking practices. 2. Blood-to-blood contact. Hepatitis B, C, and D spread through infected blood. This includes sharing needles, unsterilized surgical or dental tools, tattoo equipment, or even razors. 3. Unprotected intimacy. Hepatitis B is also spread through unprotected sexual contact, making it one of the most common sexually transmitted infections globally. 4. Mother-to-child perinatal transmission. In some cases, an infected mother can pass hepatitis B or C to her baby during childbirth. 5. Occupational exposure. Healthcare workers and lab technicians are at risk if they're exposed to infected blood through accidental needle pricks or contact with open wounds. Why it's called the silent killer. Here's the scariest part. You might not feel sick, no pain, no obvious symptoms, and yet hepatitis could be damaging your liver silently for years. Some people only find out they have it when they're already dealing with liver cirrhosis, liver failure, even cancer. That's why hepatitis is called the silent killer. It hides until the damage is done. So now you know, hepatitis isn't just one disease. It's a group of dangerous threats hiding in plain sight. But knowledge is your best defense. Don't take chances with your liver. Hit that subscribe button. Give this video a thumbs up. And most importantly, share this video with someone who needs to know. Because the fight against hepatitis begins with awareness. Don't ignore the signs.